Claudine Lewis, respiratory therapy care student doing trach care. So I would verify the correct patient, all of that good stuff, wash my hands, and this is a sterile procedure, so I would put gloves on after I open the kit. So I've got hydrogen peroxide in one container and sterile water in the other container. And I open my kit without breathing, coughing, sneezing on it, and make sure it's sterile. I apply my sterile gloves without touching anything else, in theory. So I've got my suction here, my gloves are on, got my 2 little trays, and extra gauze. All right, so this patient's name is Louise. Louise has a cuffed tube, and she's also on oxygen, and like when I just did that, I went unsterile. So we're going to explain this procedure to the patient. Louise, I'm here to clean up your trach site just a little bit. So I'm going to start by taking the oxygen off. This isn't real because it's just a head. So we take the oxygen off, be ready for any coughing, anything like that, because it can very easily happen. Loosen up one side without letting go. So this one snaps in, so we'll pull it out. Deflate the cuff. Deflate the cuff. And now we can pull that out, because this is a patient who's had a trach for a long time. So I've got my pipette. A Q-tip might work better. Dip in hydrogen peroxide, clean around the outside. Get a new one, dip in water, clean around the outside. Maybe clean around in there just a little bit. She might need a little bit of suctioning. Should not be more than that. Suction just a little bit while twisting. I'm having my hand over the chimney valve. Clean up the outside just a little bit. I have my obturator in my trach, which helps me place it. Place that, pull my obturator out, and put in my new inner cannula. Ask her if that feels okay, if she's breathing okay. If she has any problems during this procedure, I would stop and just oxygenate her. And gauze. Which is really tricky with one hand. I'm just saying. There we go. Much better. I'm going to attach it before I inflate my cuff, just in case there's any issues. This has got to be much easier on a person with a body. And now I know why you didn't have gauze, because that's about impossible. Can't thread the little thing through the flange there. And I want it to be about 1 finger loose. If there's any excess, it just kind of folds back under there. Reassess, make sure she's doing okay while I'm fumbling with this. There we go. And I twist it. Okay. And get 1 finger in there really well. Oh, my syringe is still attached. Handy. So reinflate my cuff. Put her back on oxygen. And as always, be prepared for them to cough at any point in time. So, and reassess, make sure she's doing okay, make sure her oxygen level is doing just fine. Thank y'all so much.